It is the popular saying that a healthy society is a wealthy one. On the Great Mind program, medical experts are available to provide solutions to various health challenges. You desire greatness in life. Successful men and women in the society are available on the Great Mind program to reveal to you the secrets to their greatness. The Great Mind of Nentiu Shugbo is a watch for all. Meet me on the program every Sunday between 3:30 and 4 p.m. Happy Sunday to you all. It is the day that the Lord has made. I will rejoice and be glad in it. It is another exciting moment with me, Bola Olayode, on the program, The Great Mind. The personality we are celebrating on the program this week is Alhaji Adegboyega Tomori, the former Vice President of National Union of Road Transport Workers. And on their segment, we are discussing the relationship between Osun Health Insurance Agency and the healthcare providers. Osun Health Insurance Agency is an organization that is fully committed to the accomplishment of its objectives of ensuring that every resident of the state has easy access to effective, quality and affordable healthcare services, protecting families from financial hardship of huge medical bills, containing the cost of healthcare services to attain efficiency, ensuring equitable distribution of health costs across different income groups, and also maintaining high standard of healthcare delivery services within the health sectors, among others. Osun Health Insurance Agency is in partnership with public and private hospitals for the full actualization of the above-mentioned set goals of the agency in the interest of the residents in Osun State, as the enrollees of Osun Health Insurance Agency are in 4 categories: the formal sector, the informal sector, the vulnerable population, and the tertiary institutions health insurance program. The chairman, board of directors, Osun Health Insurance Agency, Honorable Adeoye Adelakun, has this to say about the relationship between Osun Health Insurance Agency and the healthcare providers.
Now, basically because of the fact that the formal sector is driving the scheme, and we are lucky to have the kind of governor that we have. This is a governor that is passionate about the health of his workers, and he is ensuring that these workers are in good health. And that is why he pays not only the checkup from their salary for the premium of the former staff, but ensures that he had the 3%, because the staff will contribute to 1.5%, and double the contribution of the staff is paid, is what the government is paying on every staff in the state. And that is why the scheme will get along, because of the fact that the governor himself, since it started, because the law that set up this scheme came into existence on the 18th of November 2018. That was the day Governor Adegboyega signed the law, signed the bill to law. He assented to the bill. And that was just 7 days or thereabout to the swearing in of this governor. And there was nothing Adegboyega could do other than the fact that he initiated the fact that there must be the State Health Insurance Agency to facilitate the promotion of the health of the state. Apart from the fact that he is ensuring that the checkoff of the deduction of workers' salary is paid directly to the agency, he adds the 3% the state the government contribution to it. Aside, he had given a take-off grant of 150 million naira to the agency to take off to meet their immediate requirements for it. So that was when this agency started to really put foot on the ground. And apart from that, it also ensured that the sum of 447 million was paid to support the vulnerables, because the category we call the vulnerables are supposed to be taken care of 100%. They don't even have to pay a premium, and neither do they have to pay any co-payment for drugs. So the equity grant of the state came in even before the federal government equity grant came. And the federal government equity grant that I was talking about is what we call the Basic Healthcare Provision Fund, which the federal government has paid to really support the care of vulnerables. So, but the informal sector, these are the population of the state that are not in the workforce of the state. And they are really more than the workforce. And it is their involvement in the scheme that can sustain the scheme and give him the opportunity to carry on. God forbid, if you have a governor in this state that is not interested in the program of the health insurance scheme, that program will be dead by tomorrow. So what we are doing in the agency is to ensure that the informal sector, is taking a very big share of participation in the case. If you have informal sector participation that is very high, it will sustain the scheme.
The Executive Secretary, Board of Directors, Osun Health Insurance Agency, Dr. Adegboyega, speaks extensively on the relationship between Osun Health Insurance Agency and the healthcare providers.
Talking about assessing the performance of this agency or our scheme in providing quality healthcare for the people of this state in 1 year. The most objective means of assessing performance is by the use of data. What have we done so far? Now, if we look at, as at the beginning of the scheme, none of the civil servants that are presently on the OE scheme were on insurance, state civil servants. But as we speak today, we have 38,516 civil servants or public servants that are on the scheme. That is what is happening. And for these 38,516, we already have, enrolled 36,539 dependents. They are still coming. Initially, when we started, we were going everywhere. Ministries, departments, and agencies, local governments, telling them, come and enroll, come and perfect your enrollment so that you can start accessing care. They say, it is a government project. It's a government thing. It will not work. They're just disturbing us. They just want to be deducting our money. Be deducting the money. We're not interested. That was the initial response. So even when we gave them the forms to fill, they want a picture of their children. They want picture. Who has time for that? This scheme is working very well. Civil servants, public servants, they are going to receive this. Right now, we have a total of 75,055. That is as at the end of March. As I speak to you now, the number has increased of those who are enrolled. The dependents are increasing by the day. because they are now bringing their children's birth certificate, they are bringing their marriage certificates to authenticate their spouses qualification for the scheme. So people are enjoying this. That's concerning the formal sector. Now concerning the informal sector, we had a total of 1,251 persons already that have enrolled, market women, Okada riders and things. We have 1,251. The principals there is 1,138, and then dependents, we have 113 dependents amongst those who have already registered. Now we also have the enrollees under the priority population. We call it the priority population for the vulnerable persons, people that are living with disabilities who are not employed, the old pensioners that are earning very little sometimes, some of them 3,000, 5,000. We have put some of them on this, and we still ask the Nigerian Union of Pensioners to add more names. The more we have them in their various pay units, the more we capture them so that they can begin to enjoy the scheme. And for the priority population program, it is free of charge. That is the one we call free health under Osun Health Insurance scheme, because it is the Osun Health Insurance scheme provides services to people on equitable basis. If you have small money, you pay small money. If you have you don't have money, you are not a worker, you don't have any means of livelihood and things, you get the treatment free of charge. And then if you are a high earner, you pay to subsidize for those who are. That's the principle in social health insurance: social solidarity and equity. So based on that, we already have 15,050 persons. 15,050 persons that are already registered with us. Some have already started receiving services. Out of all of this, of course, I said the albinos, the people living with disabilities, and then the aged, pensioners and what have you, they are all included in this 15,000.
From Olazo Komisumanu, Director of Programs, Osun Health Insurance Agency, also has this to say.
All agencies of government, I make bold today to say that I still want to know any agency that is more scientific than Osun Health Insurance Agency. Scientific in the sense that all our methods and procedures are backed by internationally verified scientific procedures. Understand? And each of our departments, you can see something like Osun Health Insurance Scheme strategic objectives. We know where we are going. We know how we are going to get there. And the logistics for getting there, I think that is one of our major strengths as backed by the present day government. The logistics for getting there, we didn't face any difficulty, unlike other states, in getting the logistics of getting to where we want to go, we want to get to. And as of today, I make bold to say that we are in the forefront of the state social health insurance scheme in Nigeria.
Crystal Cross Specialist Hospital at Onward Area in Oshogbo is one of the facilities chosen by Osun Health Insurance Agency, where the residents in the state easily access effective, quality and affordable healthcare services provided by Osun Health Insurance Agency. The representative of Dr. Olajumoke, the managing director of the hospital, Dr. Praise Nebechukwu, who eulogizes the efficiency of Osun Health Insurance Agency, has this to say about the relationship between his hospital and Osun Health Insurance Agency.
The relationship of this hospital, Crystal Cross, with OIS has been a very cordial one. There has never been an issue with both the patient and the OIS as an establishment. Customers do pay 10% fee for services rendered. Then there's always been a speedy response of OIS establishment to calls or messages. Like I said earlier, the relationship of this hospital with OIS has been a very cordial one. There has never been any hitch, either in payment or receiving of income that the hospital deserves for services rendered. It has always been a very cordial one. On behalf of the MD of Crystal Core Specialist Hospital, Dr. Alhaji, I want to appreciate the efforts of Osun Health Insurance Scheme in this hospital. The relationship has been a very cordial one since 2 years in which we have been in partnership. It has been going smoothly. There has never been a hitch in services rendered. And also want to thank the government of Osun State, the executive director of the Osun Health Insurance Scheme. I want to appreciate his efforts and commend the valiant way in which he has handled the establishment, and also to encourage for more people in the private sector to be allowed, to know the importance of OE's insurance scheme, so that they can come and then there will be more people and more services to be rendered as a hospital.
Since Osun Health Insurance Agency is fully committed to making the residents in Osun State to access quality health care without tears, every resident in the state should strive to enroll with the agency and protect their families from financial hardship of huge medical bills. Now to the segment where we celebrate the achievers of our time. As I said earlier, the personality we are celebrating on the program this week is the Alhaji Adegboyega Tomori, former Vice President of National Union of Road Transport Workers, who just clocked 82. We are celebrating him because of the impact he has succeeded in making in the lives of the people, and also his life story, which can be likened to that of Joseph in the Bible.
Alhaji Adegboyega Tomori, who was born in October 1, 1939, to late Alhaji Gbadamosi Ajiboye Tomori and late Felicia Jokotade Tomori, aid respectively from the high chieftaincy families of Balogun Kujeyo and Balogun Biro in Osogbo. He lost his father in 1949 when he was only 10 years old, but a mother, being a very successful businesswoman, encouraged him to attend school. He started his elementary education at St. Mary Owope, Osogbo.
My late father was a produce buyer. He has his cocoa plantation at Alhaji area. Incidentally, he wanted me to be a farmer, being a male child. My late father was a polygamist. He married 4 wives. My late mother was the most junior. Ironically, my late mother had 7 children, and we have the whole 7 remain true now. Out of all the children my father had, all the children produced by all the 4 wives, it is that of my mother, myself, and my immediate sister. It was the sisters of my late mother that made me to attend school. I started schooling at the age of 7. I started my school career in the year 1946 as a Mary, a walkway. Unfortunately, my father died in 1949 at the tender age of 10 years. I was 10 years old when my father died. I love my father more than my mother, to be sincere. Probably because of the same resemblance with me and my mother and my father. My father used to drive away my mother because at the time when he was punishing me, my mother would begin to say, "You want to kill this boy?" And people are accusing you, say you are eunuch. The only one remaining for you. He will drive away my mother from home. Then she will eventually pack to her parents' house at Okebale. Incidentally, her father was a disciplinarian because he was an auxiliary inspector. As at the time when my mother was about settling down in her father's house, the father will ask her, have that pattern question, say, Felicia, what brought you here? Say, His husband who wanted to kill the only son he had, he said, where is the son now? Since you are being in my house, where is the son you are trying to protect? I will never go to and meet my mother. I prefer to stay with my late father. Then the father will direct us, you better go back to your husband. The son you are trying to defend does not support you. This is how I used to resolve the dispute, the domestic dispute, matrimonial dispute between my father and my mother. When I attended school, I was given accelerated promotion to class 2. 1946, I was promoted 1947 to class 2. Then they were using ink. We have inkwell and gaining. In our era, we use chalk, white chalk, and slate. Since I'm not conversant with the usage of pen, the way I used to rub off my slate, I was not doing the exercise. So I was citadel to continue to go to Ijapa. We call it Ijapa, that is infant 2 there. At Ijapa, they use pencil and eraser. I'm not conversant with the usage of pencil and eraser. So I had to repeat that class. Then I pick up again. I was leading the class.
2 of his teachers have this to say about him.
Olugbodi is a very bright boy, very clever. I taught him right from the infant to primary 6. Okay. He was my favorite boy in the school.
As much as I know him, he's a nice boy, well bred. The parents are rich, very rich, because the parents have died. The mother especially, a beautiful old woman. She cared for him, and I could see that the boy picked up well. When he was in school, I would say he's one of the neatest boys. And I noticed he used to play ball. Although there is no child who will not be rascally, he doesn't want people to cheat him. And when he started to grow older, he picked position. It means he was serious with the lectures and assuming correctly.
Alhaji Adegboyega Tomori Olugbodi has been a genius right from his childhood. He is multi-talented. Because of his love for music, he enrolled with Adegboyega musical group in 1953 as a leading vocalist. Alhaji Adegboyega Tomori Olugbodi has this experience while serving in the Nigerian police force. His experience, which can be likened to that of Joseph in the Bible, is what has made him what he is today.
My IQ used to worry me because if you give me order, even though you are my superior, because of the discipline of the police, if you are not better off than I do, because I'm your subordinate, I won't obey you. Instead of allowing me to spend 1 year at Oyo, I was transferred to Ogbomoso. The same 1966. I was in Ogbomoso for a few months again before I was brought down to Osogbo. I was in Osogbo when I had an accident on motorcycle. 11th of January 1967, the first accident I had on motorcycle, one tipper collided with me. And the axiom I mentioned is that anybody who will prosper in life will suffer. But if you are resolute and pushful, things will work in your favor. I was a policeman, yes, people respect me because I have a little bit of intelligence. Because of a petty jealousy, enviousness. You know, when someone is intelligent, he's subject of enviousness by his colleagues. I was investigating a case here in 1976 where a case of robbery was reported. I referred to state CID. When I was called that they said I was releasing people who bought stolen vehicle myself. We don't deal with anti-vehicle theft. We deal with robbery, except where it formulates part of we are investigating. We got there. Eventually, we were into court because all the constructed allegations. The moment I asked them few questions, the thing will break down. They went and brought criminals to come and begin to testify against us in the court martial. Not knowing what God has ahead of me. Yes, it happened to Joseph. When he dreamt and told his father, the father said, "Quick, within you, don't allow your brethren to hear." Eventually, he was sold to slavery. From slavery, he suffered with the wife of Pharaoh, who concocted story saying he wanted to fornicate her. Look what happened to Joseph in the Bible. See my position today, I thank God. We are recommended for dismissal. We appeal and we are taken to court on concocted on 4 counts of conspiracy, demanding, receiving, and stealing. From that man, 500 naira. They say, what we don't receive, we cannot steal it. But we are guilty of conspiracy and demanding. Demanding what? That's why I don't believe few of the tires in this country are against God's injunctions. There is no judgment that they will not influence. They influence judgment. Human being be what we are. They confirm that our sentence. We are sentenced. Confirmed 2 years at Agodi. I thank God we were able to face that ordeal. I did not go to special class. I was put in special class. Let inspector be special class. I want to face this ordeal. And let me begin to meditate and begin to tell my God, if I committed sin, please forgive me. But if it is concocted case, out of sheer jealousy, you know how you'll be able to escape me when I'm out of this problem.
After being discharged from prison, he started life afresh through the help of a friend who gave him a boost because of the leadership traits in him. He has been trusted with different positions of authorities before his elevation to the position of National Vice President of Nigeria Union of Road Transport Workers. He led the Osun State branch of the union for 10 years. From our end here, we wish Alhaji Adegboyega Tomori more years of fruitful service to God and humanity. On that note, we are ending this week's edition of the program, The Great Mind. Next Sunday is another date. God willing. Again, stay blessed.